Hi class, my name is Samantha Iberg and my partner Isabella and I did our presentation on conversion aphonia. So what is conversion aphonia? We're going to dive in first by looking at what conversion is. The word conversion refers to a substitution of a somatic symptom for a repressed idea. Now, a somatic symptom is just a significant physical symptom such as pain that results from some mental distress. Now, conversion disorders was a term defined by Sigmund Freud to explain the unconscious role in our physical symptoms that could not be explained by an organic disorder. Aphonia is just one of the symptoms or types of a conversion disorder. It can also be in the form of blindness, paralysis, dystonia, which is uncontrollable muscle spasms, swallowing difficulties, motor tics, difficulty walking, hallucinations, and dementia. SLPs can be involved in the process in many of these. People with conversion disorders cannot control their symptoms. They are not malingers. They are not faking it. Additionally, what is aphonia? Aphonia is defined as the loss of the ability to speak. So when we put these together, we get conversion aphonia is a psychogenic voice disorder where the patient exhibits voice loss. Next, we're going to look at some facts about conversion disorders. According to National Center of Biotechnology information, 82% of adults with a conversion disorder stop working because of their symptoms. This is a large amount, and for people with conversion aphonia, that means that they are not able to speak, and for many jobs, speaking is important and for everyday life. So it is critical that SLPs work with these patients to get them back and ready to do their daily life things. Additionally, the incidence of conversion symptoms varies among the population studied. This means that our incidence and prevalence would change depending on our demographics or geographics of the population that we are studying. So it is estimated that 20 to 25% of patients in a general hospital setting have individual symptoms of conversion. And additionally, among adults, women diagnosed with a conversion disorder outnumber men by a 2-to-1 to 10-to-1 ratio. Other sources have said that the prevalence of this for women is 8 times higher than men. When we look over at this picture to the right, we see that rural population, lack of education, lower socioeconomic status, female sex, younger age, and history of sexual or physical abuse all play a role into if a person is going to be more likely to have a conversion disorder. Our next slide talks about our causes. So what causes this? Well, there is no evidence of a physical or neurological cause. It is thought to relate to stress, depression, and anxiety, and oftentimes it is associated with a significant traumatic event or severe stress. Next, we're going to look at some of the factors associated with conversion aphonia. The National Center of Biotechnology information provided this image and graph and describes some of the social factors, psychological factors, biological factors, along with comorbidities that go along with conversion disorders. This is not specific to conversion aphonia, but just conversion disorders in general. So some of the social factors that we looked at on a previous slide were living in a rural area, education level, cultural, as well as socioeconomic status. Those are just some of our social factors that we look at when assessing a patient who may have conversion aphonia or a conversion disorder. Additionally, we will look at psychological factors, which are psychological stress, what are their ability to cope with the stress, and what internal psychological conflicts are they having occur in their life, as well as biological factors, which is the female gender, young age. And additionally, we will see that we will look at comorbidities. So are there mood disorders, phobias, obsession, post-traumatic stress disorder, schizophrenia, what other things go along that may impact this disorder?
So now that we looked at some of the factors and causes of conversion aphonia, we're going to look at some of the signs and symptoms. And signs that a person may have conversion aphonia include going through severe stress, trauma, anxiety, having a sudden illness due to extreme stress, feeling ill, going unconscious, having difficulty talking, and having a history of psychological problems that improve when physical symptoms appear. So for example, if a person has anxiety and it produces stomach aches, fainting, or headaches, but once those physical symptoms are present, it allows them to focus on their physical symptoms. Oh, my head hurts so bad, instead of thinking about why they're anxious, so their psychological problem is going to improve because they'll no longer be thinking about it. They're going to be focused on the physical problem, and it manifests as a physical symptom. So it's psychological symptoms manifesting as physical symptoms. And the symptoms of a person with conversion aphonia can range from having a weak voice or having no voice at all. So when people with conversion aphonia attempt to phonate, meaning produce speech, they can't do much. So if conversion aphonia is less severe, their voice might produce a whisper that's high pitched, but if the aphonia is super severe, they might not be able to speak at all. And there's also pain in the neck and extrinsic laryngeal muscle tightness and difficulty swallowing because the food or fluids may go into the lungs. And we wanted to show a video of the vocal folds for a person with conversion aphonia, and you'll be able to see in the video that when they attempt to phonate, they can barely make any sounds. It's like a faint whisper that's barely even there. So how does conversion aphonia affect the voice? When people have conversion aphonia, their voice is lost very quickly and they almost have no control over it. However, they still have a resonant cough and can still laugh even though they might not be able to speak, which is strange. There's also no lesions in the organs of the larynx or vocal folds, and the pathology of the vocal fold is really no different than normal, as you could see from that video. And like we said earlier, it may be more difficult to swallow with conversion aphonia because the liquid and fluids might go into the lungs, and it has a large socio-emotional functioning. It has a large impact on that, because the client literally can no longer speak, so it's difficult to communicate with others. And if the client is social in nature or has a job where they talk with people for a living, like teaching or sales, it's going to impact them a lot more emotionally. And that can also cause patients to feel isolated and discouraged, which could lead them to fall into a depression if it's not treated right away, which could worsen their symptoms. And Kohlbrunner said that with every day that the aphonia continues, the disorder is likely to become more and more fixed. However, there's a lack of studies in the literature reporting fixation of aphonia after a lengthy period of voicelessness, but that's why it's important that it's evaluated early on, which brings us to our next slide on the evaluation of conversion aphonia. Conversion aphonia is also really difficult to diagnose, and the DSM criteria for diagnosing aphonia is one or more symptoms of altered voluntary motor or sensory function, so clinical findings that show evidence of incompatibility between the symptoms and recognized neurological or medical conditions, symptoms, or deficits that are not better explained by another medical or mental disorder, and symptoms or deficit that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning or warrants medical evaluation. And in evaluation, they must evaluate the patient's psychiatric and medical history to see if the loss of voice could be explained by something else, or to see if they have a history of developing physical symptoms from a mental disorder. And they also do a visual assessment, usually done through a videoscopy, which will show that non-phonatory movements are common and normal. And when voicing is attempted, there is commonly irregular movement, and the folds are not able to adduct enough to produce a sufficient vibratory cycle. And it also may be suspected when the patient is asked to cough, because if the patient is able to produce an audible cough, that could rule out any neurogenic causation and lead the clinician to know that it is a psychogenic disorder. Just like conversion aphonia must be evaluated early on, it's really important to initiate treatment as fast as possible so that successful reinstatement of a resonant voice can be achieved during the first session, because treatment failures can lead to fixation of this disorder. And in treatment, the voice can be reestablished in a single session that lasts like a few seconds up to hours, and the most common forms of treatment are cognitive behavior therapy and voice therapy. In cognitive behavior therapy, they focus on improving self-esteem, increasing the capacity to express emotions, and improving the ability to communicate comfortably with others. And cognitive behavior therapists will educate their clients on how their emotions, thoughts, and behaviors all interact to influence each other. They will then go into mental thoughts and beliefs and break them down so that we can change the way we think and behave. And then voice therapy will focus on psychogenic habituated conversation, vocal function exercise programs, and acoustic masking. And in more severe cases, there may be psychiatric treatment or surgery. And psychiatric treatment is drug therapy where clients may take antidepressants or other drugs to lessen their psychological symptoms. But when none of that helps, surgery is necessary, so injections of botulinum toxin is injected into the cricothyroid muscle. It's hard to find information on conversion aphonia, but for people that have conversion aphonia or family members, we thought that these would be really good websites. The first one has a frequently answered question section for questions like, do conversion disorders come and go, and specifics that you might be wondering if you have conversion disorder. The second website has a lot of information that's easy to follow and includes things like symptoms, so you know what to look for if you suspect that you might have conversion aphonia. And then lastly, there's a link to a Facebook support group page so that people with conversion aphonia do not feel isolated and they know they're not alone.
Moving on to our reflection, I chose this disorder because it was confusing to me at first. It was easier for me to understand and even see the structural voice disorders such as polyps, granulomas, cysts, and conversion aphonia is less visible to viewers, but it's very real to the client. And so this is why I wanted to research it, to know more about it, so that I could visualize it in my head and understand what is actually going on. And while investigating this disorder, I became surprised at how many different types of conversion disorders there are and the symptoms that go along with it.
It was really interesting to learn about conversion aphonia because of all of the psychological variables that are involved and how psychological variables can influence conversion aphonia and result in a total loss of voice, which is just crazy. But after learning about it more, I feel hopeful that people that have conversion aphonia would be able to receive help for their problem and get better.